Now let's see how you can do that, young man. On your mark, ready, set, and go.
It's a Top Gun competition at the American College of Surgeons Convention in New Orleans. Dr. Butch Rosser is teaching the surgeons of tomorrow how to do laparoscopic surgery, like this, where doctors just make tiny little holes in your skin, enough to insert a camera, and long chopstick-type tools in your stomach area to perform the surgery, only seeing your internal organs on a TV monitor in the OR. But Dr. Rosser is considered one of the best at this in the world, and it's all because he figured out something no one else had thought of.
In 1971, I used to love playing pong in the student union at Ole Miss, never thinking that I was doing anything other than having a good time.
Pong, the first video game, and the much more sophisticated ones that have followed, proved to be the reason for his excellent hand-eye coordination, visual processing skills, and use of his non-dominant hand. And he figured out that just like in Top Gun military training, no matter how good the new technology is, the pilot or surgeon has to be trained. And as the director of the Advanced Medical Technology Institute at Beth Israel Medical Center in New York City, he's training med students like never before.
I don't even know if I could have tied a suture in 10 minutes. That's when you time us out, you're done. And then now I could do it in 45 seconds.
Dr. Rosser even put his video game theory to an academic and scientific investigation, and in a published study found it was true. Doctors good at certain video games were 27% faster and committed 37% fewer errors during this keyhole-type surgery.
So now, something that the public thinks is bad can be embraced for something good if properly utilized.
But surgical technique isn't all students can learn from Dr. Rosser. This renowned surgeon, from humble beginnings growing up in the Mississippi Delta, made a mature decision back in college at Ole Miss.
So when it came down to decide whether or not I was going to play football and maybe one day be in the Hall of Fame of the NFL or be a doctor, in the end, even as a young man, I made the right decision.
His role models, his parents, both teachers, taught him there was a bigger responsibility. Show other young African-American children they can make a difference in the world, not just on a football field. And now he wants to close the healthcare gap between the haves and have-nots, because he remembers that day in med school at Ole Miss, in way over his head, newlywed with children, having a hard time keeping up, and failing 2 classes when he went before the advancement board and the doctors there gave him a second chance.
And I promised them that I would not let them down. And thank God that he let me fulfill my promise, and I don't think I turned out so bad.
Well, no, he hasn't. But our story doesn't end there. 3 years ago, Dr. Rosser weighed 160 pounds more than he does now. He says the weight was literally killing him. Then one of his students, who he trained to do laparoscopic stomach bypass surgery, did the procedure on him. And now Dr. Rosser teaches people around the world how to do the weight loss procedure.